Good morning, Mr. President, Dr. Margaret Chan, Director General of the World Health Organization, distinguished delegates, ladies and gentlemen. First of all, I would like to congratulate you, Mr. President, and the other office bearers on your election and wish you every success in chairing this session of the Assembly, which has a very full and interesting agenda. I will focus my statement on summarizing the highlights of two sessions of the Executive Board: the 137th session held in May 2015 and the 138th session held in January 2016. The 137th session of the Board met for 2 days, considered 15 items, and sub-items adopted 7 draft resolutions, including a decision on strategic budget space allocation. In addition, the Board considered and noted reports on the financing dialogue, the governance and development of WHO's guidelines, the draft accountability framework for newborn health and evaluation. The Board appointed members to fill the vacant position of the Independent Expert Oversight Advisory Committee. At its 138th session, the Board adopted an agenda with 55 items and sub-items and 68 accompanying documents, including the report of regional committees. I must say, this was a historic meeting. Historic because it had the largest attendance ever of over 1,000 members and non-state actors attending this meeting. The Board met for 6 days and held 2 evening sessions and produced 13 resolutions and 12 decisions. Under WHO reform, the Board considered 3 items. Firstly, the overview of reform implementation, and acknowledged with appreciation progress made by Secretariat. Representative of member states, however, also called for deeper and more accelerated pace of reform overall. Secondly, the Board discussed governance reform and decided to convene as soon as possible an open-ended intergovernmental meeting whose outcome would be submitted to this Assembly. Again, there was extensive debate and another informal discussion on the draft framework of engagement with non-state actors. The Board has endorsed the request for an open-ended intergovernmental meeting to extend its mandate and hold a final session in order to produce a consensus text, and I would like to repeat, in order to produce a consensus text and draft resolution for consideration at this Health Assembly. In the areas of communicable diseases and preparedness, surveillance and response, the Board considered the report of the first meeting of the Review Committee on the role of the international health regulations in the Ebola outbreak and response, and decided that the Secretariat should analyze how implementation of Nagoya Protocol on access to genetic resources and the fair and equitable sharing of benefits might affect the sharing of pathogens and potential public health implications. With respect to WHO's work in health emergency management, the Board discussed and noted the reports of the WHO response in severe large-scale emergencies and 2014 Ebola virus disease outbreak. In this context, The Special Envoy of the United Nations Secretary General on Ebola provided an update on the work of the advisory group on reform of WHO's work in outbreaks and emergencies with health and humanitarian consequences, which has been established in July 2015. The board also discussed and noted a report on the high-level design for the new WHO program on health emergencies and proposed an independent oversight committee that will report to the board, through the board also to the Assembly. The board noted the report and the Global Action Plan on antimicrobial resistance, options including potential deliverables for the conduct of a high-level meeting in 2016, and recognized that Secretariat would convene a member state consultation on options for establishing a global development and stewardship framework to fight antimicrobial resistance before the 69th World Health Assembly. Following discussion of the draft global health sector strategies on HIV, viral hepatitis, and sexually transmitted infections, the board agreed that the Secretariat would finalize the strategies in light of comments made and submit all three to the 69th World Health Assembly with a draft resolution recommending their endorsement. The board adopted a resolution on addressing the burden of mycetoma and requested the Director General to include mycetoma as a neglected tropical disease. The board discussed and noted the report of health in the 2030 Agenda for Sustainable Development. The board recommended that the Health Assembly adopt a resolution on strengthening essential public health functions in support of universal health coverage. In addition, following discussions on a second proposed draft resolution, the same agenda item, it was agreed by the board that intersessional consultation should continue so that the draft resolution could be finalized when the Assembly convenes. The board discussed the report on the operational plan to take forward the global strategy on women's, children's, and adolescent health, and agreed that a draft resolution on the operational plan would be prepared and submitted for consideration by this Assembly. The board has also considered the draft roadmap for an enhanced global response to the adverse health effects of air pollution. The board considered a draft resolution on the role of the health sector in the sound management of chemicals. And informal discussions on this text would be undertaken with a view of finalizing this at this Assembly. The board has discussed the report of addressing global shortages of medicines and safety and accessibility of children's medication. And a draft resolution has been presented, and in the intersessional process, there's been discussions with regard to this, and the final resolutions will be concluded at this Assembly. The board also noted reports on the update on the health workforce and the second round of national reporting in the implementation of the WHO Global Code of Practice on the international recruitment of health personnel. It adopted a resolution on strengthening integrated, people-centered health services and is recommending to this Assembly that the framework on integrated people health services be adopted. The board noted reports and progress on comprehensive evaluation of the global strategy and plan of action on public health, innovation, and intellectual property, and an open-ended meeting of member states was convened to discuss a follow-up to the report of the Consultative Expert Working Group on Research and Development. So with regard to non-communicable diseases, the board discussed the report on maternal, infant, and young children nutrition, which contained guidance on ending inappropriate promotion on foods for infants and children. So the Secretariat has been tasked and asked to take into account comments that were made during our deliberations. So the board has also considered the resolution that is addressing challenges of United Nations Decade of Action for Road Safety. The board has also recommended adoption of WHO Global Action Plan to strengthen the role of the health system within a national multi-sectoral response to address interpersonal violence, in particular against women, children, and against children. Against women, girls, and against children as well. So we adopted a resolution on the responses to specific assignments in preparation for the third high-level meeting of the United Nations General Assembly on prevention and control of non-communicable diseases. The board noted the report of public health dimensions of the World Drug Problem, including the context of the special session of the United Nations General Assembly on the World Drug Problem. So this meeting was held in April 2016, and board members emphasized the importance of public health aspects as outlined in the report. The board adopted a decision on the process for the election of the Director General of the World Health Organization and recommended that the Health Assembly should consider adopting a resolution to require that nominated candidates for the post of Director General should address the Assembly before the vote on the appointment. So this is a new process that was not in place before. So the board noted the report on evaluation and approved the organization-wide work plan for 2016-2017, and the board also considered an update on the Geneva buildings renovation strategy and adopted a resolution on real estate, which requested the Director General to establish a member states advisory committee that will provide guidance, monitoring, and oversight to the renovation project and recommended a decision to the Health Assembly. The board noted the reports on the financing of the program budget for 2015-16 and the scale of assessments and adopted the scale of assessments for 2016. Mr. President, the other executive board representatives, members of the Bureau, would like to assure you that we stand ready to lend our full support and provide additional information as required on how the board dealt with certain items under consideration, but also doing so, we will facilitate the work of the Assembly. I wanted to take this opportunity to say that this was a special executive board. It was special in that it was full of poetry, it was full of songs, and there were also chocolates being eaten, even though it is not desirable or it is not recommended. But we have understood for some published papers that chocolates do alter moods, and they do have a propensity to influence our behavior. But I'd also like to caution that the mood benefits of chocolate consumption are ephemeral. So we could not just rely on chocolates alone, but also songs and poetry. I would like to thank you.